Hello and welcome to VST News. I am Vijay Shekhar. Today I have with me Dr. Faruqi, an open heart surgeon, a senior most doctor who has performed the first open heart surgery in Visakhapatnam. We'll try and talk to him and find out more details as to what are the case studies that he has come across his career spanning over 25 years, and more details as to how today's generation of people needs to take care of their heart. Let's talk to Dr. Faruqi. Dr. Faruqi,
Yes.
thank you very much for giving us time in your busy schedule to talk to us and give us some insights on how the heart functions or what care should we take in terms of our health. It's indeed a pleasure to meet you. Thank you very much for giving us time.
Thank you very much for introducing me. I am Dr. Faruqi. I am a cardiac thoracic surgeon, and I just tell briefly how we landed up in Visakhapatnam in year 99, and it was a great moment for me to bring my team from Vijayawada here, and and I would say that it was a great moment for the city of destiny, Visakhapatnam, because we brought the expertise, we brought the skill, we brought the insight of the science of cardiology and cardiothoracic surgery to Visakhapatnam city. And we have got the honor of performing the first bypass surgery in Visakhapatnam and around surrounding area up to Vijayawada. There was no bypass surgery was going on in this region. So we started that, and the patient is still alive. Patient from
That is great.
from Ankapalli.
Okay, okay.
And that's how we started. And following which there is a story.
Okay.
Like it's a long, cherishable journey of 25 years for me, because we have done enormous amount of bypass surgeries, open heart surgery, children, and I would like to say a huge thanks to the people of Vizagites, as well as the professionals, the local cardiologists, local doctors supporting us to carry on this mission and this challenge. And we are still continuing that, and our main motto is the service first.
Yes.
Service to the mankind, and we want first safety and longevity and the betterment of the patient beyond anything else.
Yeah.
And now you have put it a question that over 25 years, how the this your branch, cardiology and cardiac surgery, evolved in the in Visakhapatnam. I would say, as somebody asked, whether the adult were also getting the heart problem that time. I say yes, because the major factors which involve the heart, one is the diabetes, then comes the high blood pressure, hypertension, third one smoking, and then high cholesterol, which were present that time also and now also. And for that, as a precaution, I say one sentence, which is very, very pertinent sentence, is like the safety of 1 rupee in prevention will save you from spending thousands of rupees in your disease. So please, all the people of the Visakhapatnam, please focus on prevention of the heart problem rather than going later stage for the treatment of the heart attack. Because when you start preventing the heart problem and all that, then you have to focus on your diet.
Yeah.
Yes. that what kind of diet modification, then exercise and lifestyle modification, as well as don't make your life sedentary, so that you remain fit and keep yourself fit, away from the not only the heart ailments as well as the other diseases to your body.
Very insightful thoughts, Dr. Faruqi. But we will go back 25 years back, and I want to understand when you first performed the open heart surgery, how much equipment did we have at that point in time to perform such kind of a surgery, one of its kind, the first one in Vizag, and you have a patient who needs a heart to be transplanted. What equipment did you have? What support staff did you have? How did you feel? Were you nervous, or what exactly happened? Run us through your experience of that first open heart surgery.
Good question.
Thank you.
Because one thing I must say, I was excited, not nervous.
Okay.
As well as my team was excited. And regarding the equipment support and the paramedical and the staff support, we before we embarked on the this first patient, we made a mock drill. We made sure that what we are going to do, because I brought some of the skillful and senior sisters with me from Visakhapatnam who were working with us, as well as the anesthetists. The equipments were fair enough for us to perform the bypass surgery.
Okay.
As far as for that, I must say big thanks to Apollo organization, because they provided us the basic and that time prevailing state of art equipments, the instruments, so that we could perform the best of the best.
So Apollo stands, that's the reason why I primarily think Apollo stands as one of stalwart in terms of heart related issues for patients to be cured very easily. When you compare 25 years down the lane to what we are today with the Apollo equipment that we have, I think it is far easier, or it's far more, the conversion rate or the success rate of the operations are highly rated, in particular Apollo hospitals. Is that true, sir?
That is true, very true, because not only because of the skill of the personnel, at the same time, see, to overall outcome of the patient depends on many things.
Yeah.
Where you are performing, first thing how you are performing.
Correct.
Next comes where you are performing and what is the support system.
Correct.
You are getting.
And we believe Apollo has the best support system.
Yes.
And that's where the conversion or the success rate is at
multiplies.
It peak. Right.
And see, you should know that the ambience where we perform surgery, it is not a simple operation theatre. It's a very well equipped and state of the art operation theatre.
Yeah, because of one's life is at risk, we need the state of the art equipment, and Apollo does certainly have that, is what Mr. Faruqi has to say. Moving on to the next question that I have today for him. Dr. Faruqi, now these days, these heart-related problems are common across all age groups. Earlier, say when you first performed the heart surgery, it should be a person who, I don't even know whom you have performed on, but he should be an age above 50 or 55 plus. But today we have 30 plus also having some heart-related issues or transplants or stunts in this thing. What is the main reason why all age groups are falling into the heart-related issues?
This is primarily, again, I would say, due to their personal habits, which I put it first thing, means I'll not miss the words, because I see from my eyes daily when I go for the walk, and there is small shops, I see only youngsters smoking there. So don't think otherwise, please, but smoking has not gone from our country. In spite of so much of advertisement, the government spends on that. So smoking one. Second thing is the eating habit. Now eating habits for youngsters is absolutely erratic because this junk food has come into their this thing, and the availability of the food. You wherever you sit. See, like I'm sitting here in my chamber, I can get food from anywhere because of so many
Service delivery options.
Sir, that's right. Available. So these youngsters, then I was surprised because first I was amazed that on those joints where the youngsters are smoking, even the females were also smoking. I was, Vizag has reached to that stage? No.
Vizag is
No.
soon catching up with the West culture.
But we have to make a this thing break on that. So these two, and the third reason is that their lifestyle, they don't focus on the thing. They just have different parties, so many parties. These youngsters they are having, and they eat a different kind of. So that adds to their this thing, the heart problem.
Sir, does alcohol also include to this, or just the food habits and the
No,
cigar?
alcohol also plays a very, very major role because what happens, the alcohol, the first thing gets involved with the liver, then the metabolism of the glucose. They soon develop, the youngsters, they soon develop diabetes.
Yeah.
And when they develop diabetes, you can imagine any other diseases, and heart disease is not far off.
Once you develop diabetes, the heart disease isn't far. The major three reasons what Mr. Faruqi has to say on these is number one, the eating habits, number two, the smoke, number three, the consumption of alcohol. So especially he finds it predominantly in the youth. So that is where the younger generation of the segment of people gets heart related issues, and that's what his advice is. Moving on to the next question, Mr. Faruqi, you have worked in other countries apart from India. So, how different? Because when we talk about smoke or alcohol, the Western countries have a bigger percentage of alcohol intake. They have it as a daily routine. Over here, we don't practice as a daily routine, but they do not, as my knowledge goes, they don't have as much as cardiac problems or heart problems as we do across age groups. What is the difference you find in other countries to us?
Like I worked in Australia fair bit of time, around 3 years I spent there. Then I worked in Germany. The one primary reason is that the population.
Okay.
Because if you take the statistics, the population, then there is a difference between, of course, the Australia population and India population not matchable. So if we compare it then because I have seen, but I have not seen that many youngsters coming forward for a heart problem as we see in India. Because I don't know whether our population, our people are like this, that if they see a little bit, they just embrace it in a 70%.
Okay.
Rather than just leaving it at the 1% or 2% what they have noticed and seen. So perhaps that's one of the major reasons.
So what I can think of is, does there comes down to a point where the oil and the spices intake of India to the other countries are comparatively less, and hence there is a lesser rate of heart related problems on the other side of the world?
That is very, very true. Because one is the oil. Almost all my patients who are coming for bypass surgery, I suggest that first you change your diet, like eating oil. We suggest the oil which contains less cholesterol, bad cholesterol for the heart and other bodily arteries. While abroad, those people are very conscious about the diet. One, and you have seen the abroad people, they are very, very conscious about their health and their exercise.
Okay.
No matter what happens, they will definitely do the exercise and exercise to the maximum. Which our people are, they don't get up also early morning.
Yeah, yeah. Yeah,
so
true.
uh, these are very important factors.
Dr. Faruqi, we had an interactive session, and my next question will be there are pain that comes on the left side of the chest. How do we distinguish if it's an actual chest pain or a heart pain or to a gastric pain? How do a patient or a individual identify himself? What kind of a pain is that, and what needs to be taken for that? Your insights, please.
Good. See, as far as these two important pain, one is the heart pain, the other one is the gastric pain. See, if it is a heart pain, what will happen? That it will be burning or pain. Either it will be burning sensation, person notices, or pain he notices. Pain which will go beyond the this thing 1 minute or 3 minutes.
Okay.
One. Second thing is when the pain is coming, the person will start sweating.
Okay.
Two. Third thing is when the pain is coming, then the pain will start spreading over the chest, and the patient will start doing like this
Okay.
over the chest. Whether it's a pain or burning, he will start doing like this. This is the sign of the heart pain. But when it is a gastric pain is more localized into the lower part of the chest area. Patient will get more of the burping sensation, and many times this both the pains, whether it's a heart pain or gastric pain, can this thing radiate to the left shoulder, but heart pain mainly. So gastric pain will remain more focused and confined to the lower end of the chest.
That's for the gastric pain.
Gastric pain, but higher pain will focus like this. But in both of the conditions, there will be vomiting.
Okay.
So that's how people get confused. क्या हुआ? नहीं वो gastritis हो गई sir. But he's not really differentiating between that and the heart problem. So in this situation, my suggestion, my advice is, if anybody is having in the night this problem, whether it is a gastric he is thinking, or they always think heart. Second, so he should and his family should be prepared to come to the hospital immediately.
Right. So what Mr. Faruqi says is, how do we distinguish between a heart and a gastric is, you hover around your chest and the stomach if you're having a heart pain and you have a burning sensation, and it doesn't spread to other part but it sticks over there, and the burning sensation will invariably make you to hover around your stomach doing in a circular motion. That is for a sure shot that you are having a heart related issue. So you have to come immediately to the hospital and get yourself checked. When compared to the gastric pain, you will have the pain come to the towards bottom of the stomach, on the left side of the stomach, and you have the burp sensation. That's when you distinguish between a heart pain to a gastric pain. Am I clear on that point,
Yeah.
sir? Yeah, great. So either of the cases, when, or if not in the either of the cases, on the benefit of doubt, if you are still unsure of which pain it is, you definitely have to visit a consultant or an expert to find out which pain you are having and get yourself treated. If it's a cardiac related pain or a gastric related pain, but do not do a self medication thinking that this kind of pain is only for this. That is what Mr. Faruqi has to say. So Dr. Faruqi, give us an insight as to what a patient needs to be doing, or the family member needs to do if a patient has been cardiac arrested? Say,
Yeah.
for example, he has a heart pain and he has gone unconscious, he has fainted. What immediate steps needs to be taken?
There comes the major role of the family members. They should have the basic knowledge of the doing the cardiopulmonary resuscitation. We call it CPR, and in that, first thing the relative should do is make a big thumb over the heart on the means left side of the chest, big thumb. Then you start compressing the heart up and down, and the next relative immediately should call the ambulance services, because Apollo has got the facility for 106 is 24 hours into 7 ambulance services available throughout year. And once the ambulances come, they will look after, take the patient immediately to the hospital, and then we will proceed with the angiogram and do the best for the patient life.
That's great because and one more thing that I've observed is, why do patients generally have these heart related pains or issues only during nights? Is that a myth or a
It is
fact?
not a myth.
It's not.
It
So
is
then
not.
why do we have it only at the nights?
Yeah, that's a very deep thinking question.
That's when people will sleep, and then that's when a problem arises, and then we'll have to deal with it.
This is always between 2 a.m. to 4 a.m. 2 a.m. to 4, in between, always they get chest pain or major heart problem, because that time the body physiology changes.
Okay.
First thing, patient is NBM. In the sense, he is nil oral and he has not drank water enough in the night, so he may be little dehydrated.
Okay.
So the blood becomes little more thick.
Okay.
One, which is not a very valid reason. Another valid reason is the one element in the blood, one cell is there. We call it platelets. They get shower of these cells, platelets. They come out into the circulation between 2 a.m. and 4 a.m. and they are the one which causes clots in the arteries, and when they come in shower, too many are there, they just block the arteries.
Okay.
And that's how he gets a heart attack.
Okay. Okay. So,
So
2 a.m. and 4 a.m. Is a time where most of the cases are reported, is what Mr. Faruqi has to say. But taking a glass of water before going to bed will help to an extent, if not eradicate the complete cause of it, but it will help patients' blood flow to an extent. Dr. Faruqi, you have been in the service for humanity at the topmost level for over 25 years.
in Vishakhapatnam,
In Vishakhapatnam. So how many years overall you have been in this?
36 years.
36 is a very, very great time. What is your experience like? Over 36 years, you must have seen a lot of patients. What is your experience out of that? How do you feel?
I feel, first thing, very, very much honored that God has, and at the same time, I say thanks and gratitude to the God that He has selected me for His service. Because this is a real human service. No other service like this that He cares for the human being as much as this medical
Saving lives.
Saving lives. One. And having come into this, my primary aim was to do service, as regardless of what I am, where I am, I should do the service to my fellow being. And I just give you a small example that I lived in Australia, and I had the chance, I got it also, the chance to stay there in that country, to do the
Service to
All-
people over there.
but very strong thought came to me. If I am doing giving service to these people, why can't I give to my people in India? Why I should give to some other country people? I came back. I left that job, came back, and then that still gives me a lot of happiness, and I don't regret that I stayed there. So I am still continuing to do service regardless what happens, and whether it is night or day. So in this 36 year, we made it like this, no compromise. Just keep doing work, work, work.
So 2 a.m. to 4 a.m. is what Mr. Faruqi says, that there is generally
Critical.
heart-related issues, and 2 a.m. to 4 a.m. it doesn't even bother him. Over the career spanning of 36 years, he has worked tirelessly for the people, in service of the people, saving lives and giving the best of the best services in cardiac related issues and problems for the people. Having said that, he has given a time to talk to us. It was indeed a pleasure talking to him. Thank you very, very much, Mr. Faruqi, for sharing your thoughts and insights on the subject. Until next time, thank you very much. We'll see another time with another interview or with another set of questions to know more about the cardiac related issues and the service that you are doing to the people in saving lives. Thank you very much, Mr. Faruqi. It's a pleasure.
Thank you. I'm humbled.
Thank you, sir. Thank you very much.